Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us. Our guest is Dr. Nancy Reau. She's Associate Director of Solid Organ Transplantation and Section Chief of Hepatology at Rush University Medical Center. Joining us on the program to talk about Primary Biliary Cholangitis, or PBC. It's a progressive autoimmune disease that affects the bile ducts in the liver. Welcome to the program, Dr. Reau.
Thank you so much for having me.
Now, I've given our listeners your title. Give us a little bit of your background, where you're practicing, and a little bit above and beyond your expertise as a hepatologist.
Absolutely. So most liver specialists go through internal medicine, followed by GI training, and then do more training in liver diseases. I finished all of my training, almost 2 decades ago, and I've been working in academic centers since. I've been at Rush University Medical Center for about 3 years, where I run the liver section. And there, it's a Chicago big tertiary care program, so we see all sorts of liver diseases. We have a transplant program, so we are fortunate enough to have a wonderful opportunity for those people who have progressive liver disease where we can't control or, offer them a curative option, but can at least offer them a new lease on life through organ transplantation.
Primary biliary cholangitis, or PBC, what exactly is it? And I know it affects the liver, but how does it differ from some of the other liver conditions that you may see on a daily basis?
So PBC, luckily, is not one of the most common conditions we see, and also luckily does have a therapy that can stabilize and offer great prognosis to our patients. But unlike some of our diseases where we have a known trigger, such as a virus, or we know that it's linked to something like obesity or diabetes, PBC is where your immune system suddenly targets something it doesn't like it and sends a war to that place that leads to destruction. So in PBC, that war occurs at the small bile ducts. Your bile ducts kind of look like a tree, where the branches go from big branches to smaller and smaller branches. And PBC starts by pruning or targeting the little tiny branches. Just like any tree in your backyard, if you cut enough of the big, the branches off, it can't actually do its job. You're going to kill the tree. And so for PBC, it becomes progressive when you lose the amount of bile tubing necessary to do your liver's function. And so as they lose the bile ducts, the liver can't, doesn't have the capacity to process and do all the jobs that it needs to with the bile, and that leads to injury and scar tissue and over time cirrhosis.
Who's at risk for PBC? Does it affect men and women equally?
No, PBC is highly more found in women and not men. Although I do have male patients, we probably assume it's a combination of an environmental trigger and a genetic predisposition. So we know that most individuals with PBC might find someone else in their family, or they themselves might have another immune disorder, whether it's a thyroid problem or a cousin with lupus. But you get the sense that there's something that makes their immune system slightly more responsive. And then some unknown, although there are many hypotheses, some unknown trigger turns on that immune response. And our goal is to identify that as early as possible so that we can keep that response from injuring the liver.
Now, identifying it as early as possible, are there some symptoms that are glaring, or is this something that is trial and error, hit and miss, as far as properly diagnosing PBC?
Unfortunately, most liver diseases don't have very many symptoms until they have progressed significantly. When you look back, the things we hear the most are fatigue, maybe mild belly pain, maybe some digestive issues. With PBC, we know some of our patients will also get itchy, especially on their hands and their soles before the disease is recognized, but often are found through routine labs. You go to your family doctor on an annual basis, and the blood test shows some liver test abnormalities that leads to additional information, or hopefully leads to a search for why those numbers might be at the normal range, and that eventually comes to the conclusion.
So are there any, misconceptions surrounding PBC? Because it is a liver disease, and since it falls in that category, do some people think that they've got hepatitis C or B when they've actually got PBC?
I think that anything that's linked to the liver, the number one comment my patients will tell me when they're first diagnosed is, I can't have liver disease, I don't drink. Liver injuries can occur from multiple different insults, and PBC is not the only immune problem that can occur. However, once you're told you have a liver disease, most of my patients are confused by things that are more common, such as alcohol injury or hepatitis C, because there's a lot of recognition about our first cohort and risk factors for hepatitis C. There have been a couple of outbreaks of hepatitis A. And so anything that they perceive of as a liver injury.
Now, once you suspect that someone has this condition, what types of tests? Are we talking just blood tests, or are there other types of tests to determine the condition and the severity of it?
Right. So luckily, PBC has an immune marker that occurs in the vast majority of the affected individuals. And if we have the immune marker, which is known as anti-mitochondrial antibody, we're pretty sure that we have PBC. We don't need to necessarily do a lot of invasive tests, but every patient needs to be staged. So we want to know how effective your liver disease is. We can often do that through blood tests and imaging, or more sophisticated studies that look at stiffness in the liver. The other thing that we also concentrate on are other risk factors outside the liver. Our PBC patients are at an increased risk for bone disease, osteoporosis, and osteopenia. They might develop thyroid problems over their lifetime. There's a suggested association with celiac disease. They might have Sicca syndrome, which is poor amounts of saliva or dry eyes. So they're in increased risk for gum disease, dental decay, corneal abrasion. So once you label someone or you identify them with PBC, it comes with a bucket of other screening and monitoring besides just liver.
Once you've been diagnosed properly, is this a lifetime management thing? Can it be reversed, or is a transplant imminent?
Well, I think the first point is a lifetime condition. This is your immune system. Until we can figure out how to reset your immune response, we know that we're going to have to do something for the rest of your life. That being said, there are therapies that are very effective for PBC. And if you find something early and you stabilize it, the medications can actually allow you to have a long, essentially the same quality and length of life as someone who doesn't have PBC. But the point is to find it early. Some are not lucky enough to respond.